covering the community, events, and people of Georgia, Carolina. This is the Means Report. Here is Brad Means.
Hello everybody and welcome to the Means Report. Happy that you are spending part of your Sunday with us as always. It means the world to us. Hope you had a Super Bowl Sunday last Sunday as well. You know, we had a good broadcast that day and then it was off to watch the game. I don't know about you, but our eating habits were not as healthy as they could have been at the Means house that day. I was just kind of reviewing what we had in my mind and I don't think a bit of it was healthy. So that got me thinking about overall health, and here we are in the new year, and we've talked about the tough time we have keeping resolutions. Well, health is on a lot of people's minds these days, and that's why we're going to dedicate part of our broadcast today to heart health. You know that the month of February is Women's Heart Health Month, Men's Heart Health Month, Children's Heart Health Month. We want everybody to be happy. But we have brought in an expert from Doctors Hospital to talk to the ladies in our audience today and to those who have ladies in their lives to talk about how to keep their hearts healthy. And we hope that the information is of big time use to you. Tonja Walker has been kind enough to spare some of her time to come to the set of the Means Report. Tonja is the Clinical Manager of the Cath Lab at Doctors Hospital. And Tonja, first of all, I know it's a busy month for you because it's Heart Health Month. Thanks for being here.
Thanks for having me.
You know, one of the things I learned recently about heart problems is that the signs and the symptoms are more difficult to detect in women. Tell us about that. Why aren't they things that we would immediately notice?
Sometimes women don't have symptoms that are as overt as the textbooks say, and they tend to ignore them more and to say that to make people lean toward anxiety issues or hormonal issues or something of that nature, but that's not necessarily true all the time. There can be symptoms that are having a problem with your heart.
Yeah, you hit the nail on the head. A lot of women lead very stressful lives and they say, you know what, this is just probably part of the day-to-day grind. I'm probably worried about something, I'll ignore it. What are these things that might be happening in a woman's body where the alarm needs to go off in her head? What might she be feeling?
Sometimes she may have symptoms that that are not necessarily chest pain. It may be pain that goes into her shoulders, either one, right or left, down the left arm, elbow pain, some shortness of breath, or something as simple as fatigue.
Well, how do you know when it's time to go see a doctor, or if it's something you think you could just maybe lie down in the bed and handle it yourself with a quick little rest period? How do you know when it's time to say, nah, this is more serious?
Well, our bodies have time clocks in them, and the body will let you know, look, I'm tired of feeling this way, so I might need to go and have this checked out. And it may be heart symptoms, but sometimes it may not, but it's always better to be safe than sorry.
Well, what kind of treatment options are available if you do have a heart problem? If you think it's serious and the doctor says, yep, we have an issue, it doesn't necessarily mean you're going to have surgery, does it?
No, sir, not at all. I mean, there are a lot of testing that's available to determine the procedure or whatever procedure that you may need. It may be something as simple as a stress test, an EKG, but that's up for the doctor to determine. That's not something that we as nurses can determine, or even for the patient to determine.
Is heart disease something that's specific to, or I shouldn't say specific, but is it something we see more of in a certain age group, a certain race in women today?
Heart disease is completely indiscriminate. We're seeing heart disease in patients that are younger and younger every day. So there's no particular age group that is geared towards. So any age, we've seen patients as young as their late 20s.
Some of it you can't help, right? Some of it is genetic, isn't it?
A lot of it is genetic, but a lot of it we can help, yes sir. If we start to, if you have problems with your cholesterol, take your cholesterol medicines. If you have problems with your blood pressure, you know, keep your blood pressure under control with medications. We can increase our activity. We can watch what we eat. You know, there are a lot of things that we can do to keep our hearts healthy.
What are the reasons, the main reasons you see, the main factors, I should say, when somebody comes in to the hospital and they have heart problems? Is it the things you just listed?
Sometimes yes, sometimes no. There are other risk factors that I did not mention, like smoking, diabetes that's out of control, sedentary lifestyles that lead to obesity, things of that nature.
Do we have it worse in the South?
Some might say yes.
Yeah.
Yeah.
What happens to the human heart when it becomes diseased, when it becomes sick? What causes the problems that could kill people? What happens inside your body?
Well, there are a lot of things that can happen. There are things like irregular heartbeats that, if they're not controlled, can lead to heart damage or death. There's a weak heart muscle that contributes to congestive heart failure that, if not treated or handled properly, can lead to a sick heart. And then there are blockages in the coronary arteries that cause heart attacks that can certainly lead to heart problems.
You know, one of your recommendations is to reduce blood sugar. I usually associate that with diabetes. How can lower blood sugar help lead to healthier hearts? I mean, I guess it just goes to the overall diet issue that you've been talking about the whole broadcast so far. Just everything that goes into our body might hurt us if we're not careful.
And you're certainly correct in a lot of instances. But people with diabetes, you're right, they tend not to be to consume the healthy meals that they need to. And it's an in-depth process in the body that, with the buildup of cholesterol, the making of cholesterol is linked to the diabetic process, so to speak.
You're trying so hard not to use medical terminology with me. You know, I made an A in anatomy and physiology my senior year in high school, and I can understand probably like 2 or 3 medical terms if you want to go there, but you're so nice, because I know that you're thinking you could explain heart health in clinical terms like that, and breaking it down into lay terms is sometimes more challenging. Let me ask you this. What would you say to women who are watching who are too afraid to go, who may have led sedentary lifestyles, who may have a poor diet? And ladies, you're watching right now, I know it's true, and who say, you know, I'm too far gone. I don't want to know what's wrong with me.
We all have to start somewhere. And today is a great day to start. You know, if you don't eat properly, to start eating properly. If you lead a sedentary lifestyle, today is a great day to take a stroll.
You can turn it around.
You can turn it around. It's never too late.
And you've seen it too, haven't you? Tell our viewers about, you don't have to name names, but you've seen success stories, right? Where people come in, they feel like they're at rock bottom, and by the time y'all are finished with them, they have a new lease on life?
Yes, sir, we have. We're having a heart-to-heart women's symposium on February 25th at Doctors Hospital.
It's going to be a huge event.
It is, and on that panel we'll have 4 women who have experienced some sort of incident with their heart, and they're going to discuss their symptoms. They're going to discuss what led them to the doctor's office to come to have their heart looked at, and how they felt once the procedures were over. It's a great group of women. Not all of them had the same symptoms. In fact, one of them had atypical symptoms, the ones that we discussed earlier with the shortness of breath. And there's one lady that's going to be there who didn't have any heart problems at all, but she watched her husband exhibit symptoms, and she encouraged him to go and be checked out. And he feels better now.
You know, one of my first questions had to do with the stress that a lot of women deal with on a day-to-day basis. I know that women can take it upon themselves to try to reduce that stress, but those of us who are around women, I guess if we're nicer to them and try to make their lives a little easier, that could contribute to better heart health, right?
It sure can. Valentine's Day is next week.
Yes.
It's a great time to start.
It is, yeah, great time to get started, and maybe give them some fat-free chocolate or something healthy. But even if you mess up just for a day, you can fix it the next day, right?
Yes, sir.
Dark chocolate is good for the heart, too.
Yes, sir, it is.
If you want to go with dark. Listen, I want to thank you, Tonja Walker. You do great work over at Doctors Hospital.
Thank you.
And you have done a great service to women watching today, because I bet you a couple of them out there are going to take your advice and try to lead a healthier life.
I thank you.
Anytime. It's Tonja Walker. She is the clinical manager of the Cath Lab at Doctors Hospital. She lives heart health every day of her life. She's made a career out of it, and we're grateful for that. When we come back, we're going to meet a special young lady who is on her way to the top. Who needs American Idol? You're going to meet her right here, right now, and you're going to see her going to great heights from here on out. A rising star indeed, as the Means Report continues.